We're here with Dr. John West with BreastLink. Now, Dr. West, age of first menstrual cycle is one of the risk factors for breast cancer because it increases the lifetime rate of estrogen. But we're seeing our young girls start their menstrual cycle earlier and earlier. Is this something we should be concerned for our girls, that, that they might down the line be exposed to breast cancer?
Well, there's a lot of things in society that increase the risk. If you really want to avoid breast cancer, you work out on the farm, you run 20 miles a day, you stay very skinny, you get pregnant very early, and then you go into menopause early. In sort of civilized societies, countries like ours, the women don't exercise that hard as a general rule. They tend to eat a little too much, too many McDonald's burgers. They tend to gain the weight, and that's associated with early onset of the menstrual cycle. And then the women decide they want to go, not get married early, and they want to go to grad school, so they delay the onset of the first pregnancy. It's a major risk factor. And then when they go into menopause at age 50 on average, they undergo a hormone replacement. Now that's a risk factor. So everything we do that is thought to be good in a lot of ways in a society like ours has its side effects. And breast cancer is a disease of affluent communities. You don't see this as much in rural farm communities or third world nations.
So it's also a modern disease then?
It's aggravated by modern conditions. So what we need to do is get our young girls to exercise. We need to put them on diets. I don't think I want to advise them necessarily getting pregnant early. That's not an easy factor to change. So I think that's an inevitable consequence of our society, but that's going to happen. But we need to recognize that there's only so much we can do about this. So all the more important to start doing breast self-exam early, because that's one of the few screening things they can learn to do. It's more important for us to identify high-risk categories. So if certain families show a tendency to breast cancer, then you better start your screening early. We know families that have the genetic mutation, the BRCA mutation. You should start screening with MRIs at age 25. Well, we didn't know this until very recently. We thought just getting mammograms at age 25, but we find that these women are at risk for developing radiation-related cancers, and so it's much safer to use the MRI that doesn't have x-rays. After age 30, then we can go to routine screening. And now with the new legislation, we know that we can add things like screening ultrasound and tomosynthesis. There's a whole host of things that are enabling us to diagnose breast cancer early, and timing is right for that because, as you point out, the risks are increasing because our women are developing their period early, extending the time of first pregnancy.
And what about some of the chemicals that we're using in our homes and in our environment? Are those things also leading to increased breast cancer rates?
Well, they've looked at that over and over, and they just haven't consistently come up with, radiation from these broadcast lines or from exposure to DDT was mentioned at one time. Asbestos was looked at. The one thing that actually concerns me is cell phones in breast cancer. I'm finding these young women are storing their cell phones in their bra, and I have 4 young women who have breast cancer directly below where the cell phone was placed in their bra. Now, I can't say for sure that caused it, but 2 of them are 21 years old with a short 3 or 4 year history of exposure, and then they have an area of what we call multifocal or multiple little cancers and non-invasive cancers directly in the shape of the cell phone
so that's
on their
what
breast.
They're still looking and researching to find out about. What about early menopause? Is that something that also raises the woman's risk of getting breast cancer?
No, quite the opposite. If you want to lower your risk, take your ovaries out and your risk will go down. You'll also feel miserable, but you can, some of the treatments we have is to induce menopause early, and that reduces those breast cancers that are estrogen dependent. It helps those cancers go away.
And what about hormone replacement therapies? Is that something that should be just banned altogether?
No, not at all. I think, first of all, hormone replacement therapy for 30% of the population is life-saving. These women can be so miserable they want to jump off a bridge. They're irritable. They can't sleep at night. They can't concentrate. So to deny that woman hormone replacement is absolutely unreasonable. Now, we know that estrogen alone isn't as dangerous as we once thought it was. Studies going up to 10 years show very little changes. In fact, one study showed a slight protective effect. It wasn't statistically significant. But for women with a uterus who are in menopause, who need both estrogen and progesterone, and that combination shows risk factors at about 4 years. So short term, during the sort of difficult time of perimenopause and menopause, you have a safety zone of 3 or 4 years where you can use it. But after 4 years, those women needing both estrogen and progesterone should start making efforts to cut the dose down and if they can, get off of it. I have women in their 80s that are still on hormone replacement. And when they go off the hormones, they get severe heart flashes and life isn't worth living. So, I mean, you have to individualize. And that's the thing about a lot of what we do and how we treat. You can come up with general guidelines, but the best way to treat a woman with breast cancer or to lower her risk or identify it early, you have to sit down with them and have an individualized risk program. You've got to look at their needs and how they're willing to approach the problem and work with them. But we find that there are some women that are, really anxious to follow all the guidelines. They're the easy ones, and there's women that are very resistant. We can barely get them in to do a mammogram. I've had patients come in with very large breast cancers that just have ignored them. So there's no easy answer to a lot of these questions, but I think the attention you're giving to it is really important. The audience is hopefully will share some of these thoughts and ask more questions. But we can do a lot more than we're doing, but we need an engaged group of people that are willing to take this as an important issue and move forward with it.
Absolutely. We need to stop putting our head in the sand. I mean, I have a mom who has breast cancer and I do it myself. So this is a really important show for me as well. And I thank you for coming here and giving us this information. For more information on Dr. John West, you can go to breastlink.com.